Of this meeting will be, the video meeting of this recording will be placed on the Clackamas Fire website. The regular board meeting now come to recess at 5:01 p.m. and the work session regarding the purpose, mission, and value will come to order at 5:02 p.m. Board members, the work session doesn't have a separate Zoom meeting. Please refer to the work session agenda and the packet. Now, I have to, please bear with me, I have to pull my agenda for the work session. It's right here, okay. Call to the order for ORS 192.610, 192.690. The meeting is being recorded. Do we have to call for a public comment during the work session or the regular board meeting? Regular, okay. Public comment. Tracy, is there anybody in the audience expressed interest to make any statements as a citizen?
Thank you, President Thomas. No, I did not receive any emails or phone calls for public comment. And I can check the chat.
Yeah, please do.
And I don't see anything in the chat.
Okay. Hearing there is none in the audience and have statements, we are going to have a discussion regarding the Clackamas Fire District's Fire District number one, says purpose, mission, and value. Our staff and the management have organized here to share with the board and include, add, or correct, otherwise be approved as our purpose, mission, and value statement. Chief Steve Dieters, are you presenting this?
Yes, sir. I will.
Okay. It's yours.
Okay. Well, thank you, board members, for the opportunity to talk to you tonight. So, next slide, please, Tracy. So, just a couple of slides, and then we'll put up the actual version of what we're talking about tonight. But we'll touch on the process for developing the new purpose, mission, and value statement, and then maybe we will talk about the timeline when this is set to be released internally and externally. So Tracy, if you could put up the document when you get a chance. But anyway, this really came from the district's desire to move away from the traditional mission, vision, and values, and instead move to a purpose, mission, and value statement. It'll focus on highlighting who we are as an organization with the goal of developing and caring for our people, which ultimately translates usually into better customer service. So in speaking with the chief and preparing for this, there was a lot of meetings, a long stretch of getting input and that kind of stuff. So I'll try to boil it down just for the sake of time and moving forward. But the contents from this was from the conversations with captains, battalion chiefs, staff members, firefighters, department heads, managers, shop stewards. I'm sure I'm leaving out some people, but really he went around and met with these folks, and really when talking with him, it was he asked three questions, and it was how can we serve you better? What inhibits you from meeting the mission, and how can we help you achieve your goals? And collecting all of that data along the way, brought it to the command and general staff, and then we actually had a 2-day retreat in May that covered quite a bit of district moving forward and some things, including this. And really we looked for themes and common statements and all that, and then sort of boiled it down into what you see before you, which is our purpose, our mission, and our values. And the plan is to, through our organizational briefings, which reach everybody through a 3-day period during the week, on November 30th, December 1st, and December 2nd, to roll this this out, this working document out once it's approved and goes on its way, to roll it out to make sure everybody sees it. And then I just wanted to cover just a few things. I won't read all of this just in the interest of time, but so the slogan here for you, that the you in that statement can really be anybody. It can be an employee, a staff member, a volunteer, a citizen. It's just, we boiled it down to we're just here for you in that time that you need us. So our purpose, the purpose statement is to save lives and mitigate emergencies while bringing calm to chaos, bring value to the communities we serve, and to make people's lives better. And then our mission in this statement is Clackamas Fire strives to be a well-trained team and empathetic professionals, constantly improving and empowering our people to best serve those that we are sworn to protect. And then there's a vast list of commitments, and it's impossible to capture everything, but this sort of embodies what we as an organization came up with as what we feel these are our main commitments. And then our values, you can see we value our people and the people we serve. Our focus will be on establishing teams. And then the acronym of teams is trust, empowerment, accountability, mindset, and service. And then moving forward, these are, and I'm just paraphrasing, but trust is being true to your word. And then empowerment is helping our people become who they're meant to become and maximize their talents. And then accountability is really listening to feedback and actively seek input. And then mindset, that is, we just model outward mindset, which is defined actually as being beyond ourselves and recognizing how our actions and responses impact and affect others, focusing on our purpose and our mission. And then service, continue to be an essential part of the communities and interacting with the communities and being, as we've always done, continue to be service to our communities. That is really quick, and that was really the overview, and happy to engage in any conversation you guys would like.
Any of the board members have any questions or comments? No, nothing, Chris. No, Chris is nodding it. Jim, anything? Okay, but I am the one who raised the question when suddenly I saw on the agenda on the board package, the mission statement on the top of the headline was changed. I have been a very anal about mission statement be emphasized and repeated at every meeting and every opportunity we get, because that's what we believe, and that we should be reiterating at every chance we have. Steve, how this been communicated to the rest of the district, or is this just bringing to the board so board can discuss and give the blessings, and then you can move forward? Is that the process?
Yeah, I believe you're right, Thomas. That would be part of the, certainly we're interested in your input, and we're prepared to take it on the 30th of November and the 1st of December and the 2nd to the masses through our internal outreach, and then make it effective as of January. So it'll be on our website, and the refined copy will be on the website and available to all the public.
Okay, Marilyn or Jay, I can see you on the screen. So do you anybody have any questions?
I do, Thomas.
Marilyn, go ahead.
So I guess I'm a little confused, Steve, because I thought you said that this had already been vetted through the ranks and everything. Did I misunderstand? Who has actually signed on for this, or at least seen it, and who's left to see it?
So like I said earlier, the chief has spent a lot of time meeting with different groups and all that, and then it came to the command and general staff. And then so in this form, there's a couple of grammatical changes that we need to make on this. So that's why I refer to it as a working document, but it's been vetted through the command and general staff and all of those groups. And then on the 30th, the 1st and the 2nd is designed to show it to, like I said, the masses. In our organizational briefings, that's when all the stations sign on and listen to the morning briefing and all that. So I guess it's been vetted by the leadership, and most of the staff and other folks that work here with, like I said, the plan to make it public once it's refined as far as January 1st. And then you guys are hearing about, or I presumed that you had copies of this previous. And
Yeah.
oh,
Well, actually, Marilyn, Nick sent it to us, and I questioned that, and we had some discussion about that. It was sent to us an email, and as with all the emails and everything else, we didn't really pay that close attention to it. And then I was talking to Nick about that, I questioned about that, and he said this was where every single part of rank and file involved in this mission purpose and the value. It was not derived just by the executive team or
right.
the chief or somebody else. So they have involved from Steve. How would you describe that? From bottom to top? How would you?
Yes, he met with several groups, individuals and teams, and shifts, and then brought all of that data to, like I said, that 2-day retreat, and then on to command and general staff, and then now through other folks. And the plan to do it in the organizational briefings is, I mean, obviously he couldn't speak one-on-one with everyone, but I believe that he captured quite a bit of the workforce and the staff and volunteers. So,
okay, well, just as a point of correction, I'm sure that I must have overlooked it because I don't recall having received an email that contained the document that Steve just showed on the screen. But that aside, what is the purpose, Steve, of making this change? Why are you just changing to change, or what?
well, I don't want to speak for the fire chief, but I think that, whenever you have a new administration, a change, there's that human desire to sort of make things your own and to build on the future and to make change. And there's the elected officials, you made a change in the fire chief, and along with that, I believe, and like I said, I don't want to speak for him, but it's like every 4 years the nation changes its slogan when we get a new president. So it's sort of that, and I believe this time that Nick really was careful to include everyone, which is
It's kind of a form of re-engineering the mission, purpose, and value. Correct?
Correct.
Okay. Jay?
Yeah, I was just looking back through our emails. On 9/22, we received an email from Chief Brown with this document. And I'm sure it's probably not exactly the same as it was on 9/22, but yeah, we did get a document on 9/22. Actually, I support this. I've been kind of sitting up, kind of going up against the wall on this one, listening to as this thing progressed over time. I actually think it's really important for a healthy organization to take a step back every 5 to 10 years and look and see if they're actually doing what their mission says, and if not, make appropriate corrections to that. And the mission should reflect what we're doing. And our organization has changed quite a bit over the years. We're doing a lot more with mobile integrated health, with our fire marshal's office, with our fire prevention. There's a lot of things going on in our organization that aren't just putting fires out. And so I think it's timely that our command staff took a step back and say, is our written mission actually what we do? And I think it's healthy. I think it's healthy to do that, and I think it's healthy the way that they're doing it, where our command staff is bringing all parties in the organization in on that conversation. So I applaud their efforts moving forward. The challenge, obviously, moving forward is you got to make it more than just words on a piece of paper, or in this case, on a PDF document, and make sure that we actually do those things that are in writing. So that's the challenge for all of us in these elected positions, and obviously in the command staff, is if it truly reflects what we're doing, well, then let's do it. Let's don't just talk about it. So that's kind of where I'm at on it. So, but no,
Yeah.
I think it's a good effort, and I appreciate the fact that they're at least taking a look at it.
Jay, I appreciate your endorsement on this concept. I believe in the same thing. Periodically, we ought to revisit our mission, purpose, and value. We just don't, because like you said, it changes so fast. So we need to catch up with what's going on. Anybody else? Okay, yeah, well, if there's nothing else, then board members work, let me see. The work session now ends at 5:16 and reconvene the regular board of directors meeting at 5:16. Brian Stewart, Chief Stewart, since Chief Nick Brown is not in town, you are acting on his behalf, and is there changes to the agenda?
Yes, sir, Mr. President. Thank you. There was one change to item B1. As it was posted on the website, it was requesting board approval of Mark Whitaker as budget officer for fiscal year 2022 to 2023. We've requested the amendment to that and sent a new draft out, or new agenda out to the board to include both this fiscal year 2021 and 2022, or fiscal year 22 and fiscal year 23. So that is the one change that we're requesting.
Thank you. Now, approval of the minutes of the work session on October 12th and the regular board meeting on October 18th. Does any board member, now mind you, the board members, Tracy and Brian Stewart have sent out the revised minutes of the October 18th board meeting. So did everybody have a chance to look at it, have any comments? No comments, okay. Chris, Marilyn, okay. Do I hear, oh, we don't need if there are no changes to the meeting minutes from the work session and the regular board meeting, they stand approved as written. I will now call for the state. There is nobody to make any statement from the citizens. Let me see. Presentation, annual medical report, medical director's report. Medical director, Dr. Ritu Sani. Is he in the audience?
He is, Mr. President, and I just moved him over as a panelist. There he is.
Welcome, Dr. Sani. And I'm going to mute your friend, so he won't take too much of your time. Welcome.
I'm just glad you called him my friend, because he is my friend.
He is our friend. No problem. So please, you're on.
Well, thank you very much, President Joseph. Well, I want to thank Josh, Chief Santos, for, well, just being you, Josh. I mean, first off, but also we got together and talked about what to talk about. I've got some slides. Those of you who've seen me speak before, I usually talk about hour and a half, but we'll try and knock this out in like 10 minutes or so.
We have mute ability, you know that.
So let us see if it works like it did when I practiced. Boom. All right. Can you see that?
Yes, sir.
Great. All right. Like I said, we'll try and knock this out as quickly as we can. These are sort of the three topics I just want to hit. A brief update on county stuff that I think Chief Santos has kept you pretty much in the loop on anyway. So I don't know that I'll have any new information, but he thought that having a sort of my perspective on stuff would be great. Talk a little bit about the medical direction activities and an update around what's happening in the office of the medical director. And then I do want to just sort of call attention to research. Clackamas Fire District 1, along with the other fire departments in our county, as well as AMR, participates in EMS research. And we've had just thought I'd kind of give you an update on what's happening there and where we are. And we do have some potential upcoming research coming up too. So like I said, I think Josh has kept you guys up to speed on things going on with the county. Chief Conway, who as you guys know very well, really led this group. And now it's just been really great to have him as part of the county team. But the creation of the strategic plan, and as we continue to move forward in the county strategic plan, and then Chief Santos is now the chair of that strategic planning group, to continue to sort of, much like Jay talked about with your mission, to sort of go back and kind of revisit that and make sure we're meeting those goals. And part of that has been, of course, the decision to bring in a consultant. So we underwent a process to choose a consultant, and I've been involved in EMS consultant in the past in other systems, and even earlier on in this system. And I can tell you that this was just inherently a very different process. Usually somebody's seeking a consultant because there's a problem that needs to be fixed, or there's a group or groups that are not getting along and we need to bring somebody in to listen to all sides and make some solutions. This was a lot different because everybody at the table wants to get better and wants to, and so the whole point of the consultant is sort of to sort of bring this vision that we have in the strategic plan and how to move it forward. And I think what we learned from going through this process, and Chief Santos was a participant also, was that the things that we're asking them to do are actually pretty different from what most consultancies are asking for. And we found, a consultant who actually listened to what we want versus trying to apply us into sort of a cookie cutter approach. So I think that's great. And I think it's going to allow us to grow our system and to build a system that is in which the collaboration is sort of baked in. So we're in a place right now where everybody gets along and does really well together, but we want to build the structures so that if the relationships aren't as good, that we still have all the pieces. So that's where we are going with that. And then the final piece is the performance-based contract for AMR. That piece continues to move. Chief Conway and Philip Mason, who's the public health director, are the ones working on that project, and they're working directly with the Board of County Commissioners. They will have a presentation a week from tomorrow, and I'm sorry I don't remember the time, I just realized, but there will be a presentation about that topic to the Board of Commissioners next week. All right. So I think last time we met, we were in the process of choosing, or may have just chosen, our county associate medical directors. And so I wanted to put their smiling faces up for you to see. We have decided to take a team approach to the way we are providing medical direction to the county. We also have added Sandy Fire to our county medical direction, or agencies that are under the county medical direction team. Some of you may know Dr. Turner. When he was an emergency medicine resident at OHSU, he worked with Dr. Warden on some Clackamas Fire issues and helped us with a lot of training. So Dr. Turner is an emergency physician at Legacy, primarily in Santiam or Silverton, but also working at Meridian Park. He chaired our protocol committee in 2020. And what we've done is sort of taken some of the tasks that the medical direction that our medical directors have and kind of broken them out to each other. And so he will primarily be assisting me with CFD issues, as well as quality improvement. And then he has a very specific interest in mobile integrated health and community paramedicine. So he's already been working with Amy Jo on those issues. Dr. Kofed is a great addition to our team. One of the nicest people you could really ever come across. He's an emergency physician at Kaiser. Kaiser's been in the past less of a participant in EMS activity. And so having a Kaiser physician as one of our partners is, I think, a great move. He is board certified in emergency medical services, and he did an EMS fellowship in Dallas. He has a unique interest in communications, so he'll be working directly with CCOM and LOCOM. And this is a nice fit because previously Dr. Warden was CCOM's medical director and I was LOCOM's. And so having them under one medical director as their go-to person will be helpful. And he'll be the go-to person for Sandy Fire. But I want to make it clear that we're all interchangeable with each other. We'll all be covering for each other. The structure is that I'm the medical director for all of the agencies and that they are the associate medical directors. Other clinical activities that have been going on, really doing what we can to integrate our clinical stuff so that it doesn't matter to the patient doesn't know what jersey is taking care of them, and that we are moving to being a single system that provides care rather than a bunch of agencies that provide care together. We've been moving towards equipment standardization. We have our clinical operations committee has developed a number of checklists, and then all of our kits have been standardized. And so now no matter which agency arrives on scene, all of the equipment will be the same or close enough. This may sound like kind of a no big deal, but it has been years and years and years and years and years that we've tried to pull this off, and we've finally done it. So AMR's kits will look the same as Clackamas Fire's kits, which look the same as Sandy Fire's, Lake Fires, et cetera, et cetera. We also have moved to a single patient care report amongst all of the fire districts in the county, and those reports are visible to me as the county medical director. So for quality improvement, that's a significant improvement. And then a long-term goal is standardizing our monitors. We went through a process of evaluating monitors, actually in the other county that I'm the medical director for in Washington County. And then our clinical operations committee here sort of endorsed that work. And as at some point, Clackamas Fire will need to replace the Zoll monitors that we have, and the hope is that we will all be on the same monitor platform. A couple more things, just quality improvement. We look at our heart attacks and our strokes. We've invited our hospitals to join us, and they were there at the last meeting and will be at the next meeting. We're developing key performance indicators that we're all following, and we took all that quality improvement work and we developed our multi-agency training. So our quality improvement drives our training, and which is how it's supposed to be. But so we feel pretty good about that. The last thing, kind of a medical direction front, is this integration of our data called First Watch, as well as our First Pass. And this is the type of data that we're able to look at. And I can tell you that during COVID, wildfires, ice storms, and a possible Kaiser strike, having a minute-to-minute, second-to-second view of what is happening in our system has been invaluable. This is the last 7 days in Clackamas County, and the green line the green line represents the average number of calls per hour. The blue line is where we were, and when I ran this earlier today, we were actually below average for the last 24 hours. And the red line is a 95th percentile, or kind of the danger zone. This is the total number of calls that we have per day, and what percentage of them have a turnaround time that is below 30 minutes. When you get in this sort of area where there's long turnaround times, we need to try to figure out how to manage the system better. So that's some of the stuff that we're doing with data. And then this is our first look at what's called First Pass. This system takes all of the charts, so the fire chart and the AMR chart, melds them together, and then looks for our quality improvement indicators. And we're still developing this system, but it's what we call a patient-centric view. So again, the patient doesn't care what jersey the provider's wearing. They just care that they get the care that was needed. So And then finally, just a brief minute or two about research. These papers that you see are all papers that have been written based on work that Clackamas Fire has been involved in. In the past, we were a member of what's called the Resuscitation Outcomes Consortium. This paper here is considered one of the seminal papers in hospital cardiac arrest literature. This is a side paper that I was an author on. And so literally hundreds of papers have come out of the work that Clackamas Fire has participated in. And the current set of American Heart Association guidelines are actually based on the work that we've been involved in. We are currently involved in a trial called PACT, the Pre-Hospital Airway Control in Trauma. Jay, I don't think Multnomah is on this one, correct? Multnomah is doing the K-Centra trial. So they're in a different trial. Basically what we're doing is evaluating whether doing what's called an ET tube, putting a tube in the trachea for a trauma patient that needs airway management is better than putting what's called a supraglottic device. And the way we're doing this is that the patients are basically randomized by date. So right now we're in the arm where we're doing this, and then sometime in January, we'll switch to do this. And that we expect another couple of years of enrollment. This is a multi-center trial over 10 or 12 different EMS systems in the country. And the reason I wanted to bring this up is what's called an exception from informed consent study, or EFIC. The ROC trial, or cardiac arrest trials, that we've been involved in previously were also EFIC studies. And the whole concept is, if a patient is in cardiac arrest, you really can't run in and say, hey, I'm participating in this trial. Could you please review this and sign this document? And then we can give you this drug or this drug. And so the idea is that if you have an emergency situation in which the patient could benefit, you can't feasibly get consent, that the FDA approves this exception from informed consent. You have to go through an FDA process. So it's not just an institutional review board or local IRB process, but the federal government has to approve every EFIC study. And part of what our EFIC studies include are community consultation and awareness. So all of these studies are run through OHSU and their Department of Emergency Medicine. They take care of community consultation. They also can take care of reporting the outcomes of the study. And then once a patient is enrolled, they actually take care of notifying the patient's family and obtaining consent sort of post hoc to continue to follow the patient's records. There is another trial that we'll probably be participating that looks like it's going to start in the next year to 2 years, where we compare two methods of determining the best dosage for pediatric seizures. And the way this trial is going to run, basically we'll just continue the way we do our dosing. And then on one of our protocol switch dates, we'll switch to a new protocol in which we calculate the dosing differently. This is, again, a multi-center trial with 15 to 20 EMS centers all over the country participating. So those were kind of my topics that I had. I want my brief update. I wanted to kind of give you a feel for what's going on. And I think that's all I got. So I hope any questions. I'll open it up to questions and I will stop sharing.
Thank you so much, Dr. Sani. And the fellow board members, if anybody has any comments or questions to Dr. Sani. Hearing none, I have a couple of questions for you, just for my personal information. Are you involved in the vaccination determination for the 5 to 11-year-old in the county?
I'm not sure what you mean by the vaccination.
The COVID vaccination.
COVID. Yeah, I mean, I'm sort of peripherally involved. I was actually much more involved with the when we put out the, our big vaccination,
Correct, in January.
when we're they're not doing the big clinics like they did.
Okay,
Lake Oswego Fire, who I'm also the medical director for, is planning to do some pediatric vaccination clinics. And so I have been working with their vaccine coordinator just to make sure the protocols are up to date. The protocols that our firefighters use to give the vaccinations, I'm responsible for updating those, and which actually reminds me, I have an inbox item that I need to complete, which is getting those edited and back out to Bill Conway. But the county itself in their vaccination branch, Julie Albers from the county is in charge of that, are really kind of the ones focused on that.
now, do you work with any other school district to provide vaccinations at the schools?
I am not, no.
Okay,
Like I said, Lake Oswego Fire is working directly with the Lake Oswego School District.
okay, perfect. Thank you. Anybody else have any questions? Okay, hearing none. Dr. Sani, thank you so much. And I send you a chat message and
I responded.
Okay, good. Thank you very much. And I appreciate, always nice to hear from you. Even though you're biased towards Jay, you may not be hearing everything I'm saying.
Sometimes I'm biased towards Jay, sometimes not so much.
Thank you so much. Thank you. Appreciate
All right,
it.
thank you for
You're
having
welcome
me.
to stay, or you can leave. That's we will move on to the next business item. Division Chief Doug Whiteley, could you do the presentation of Operation Santa Claus?
Absolutely. Thank you, President Joseph, members of the board. I appreciate the opportunity to present today. So thank you for sharing the screen, Tracy. So I'm here to give you a little bit of an update on Operation Santa for this year. True to form, as Steve Chief Dieters has done in the past, we definitely is worth starting with kind of a look back on the successes of last year. Tracy, if you want to hop to the next slide. Thank you. And this is not new information. I believe this was all shared with you guys in January last year, but as a kind of a look back for 2020, as part of Operation Santa, there was just over 14,000 pounds of food collected, about 2,400 toys collected, and Steve's confident in that because he said he counted every one of them himself. And then as part of that too, 265 families were served. That is less than we have worked with in the past. But given COVID, that number was reduced down quite a bit. If you want to go to the next slide. And so this is our continued new look for 2021. If you'll recall, Operation Santa did look a little bit different last year, and it will continue to look that way. Much of that is driven from COVID and some of the restrictions, and also trying to maximize safety for our staff and the community we're part of. Last year, we did not have the community parades that we'd had in previous years. And again, this year, we will not have those. We worked hard to try to come up with a plan to incorporate those this year. But given the rich history of every one of those parades historically involved donation collection, there was not really a safe, feasible way to accommodate that still with us in COVID right now. I do say that with obviously reluctance. We'd hope to have those, but we do plan to, after the first year, revisit all that and start planning for next year under the idea that we will have those parades in some form next year. So for this year, though, you want to hop back one there. For this year, though, we do have 5 community drop-off locations that we've set. If you recall, last year we had 8 of those. We did move that to 5, but we changed and expanded the hours of the 5. If you see the ones listed there, we did our best to kind of get a good cross section of the fire district to try to at least spread out the opportunities for people to drive through and donate. And so these are in basically the same locations and about the same date as they were last year, in a best attempt to try to maximize people kind of for the redundancy, recognizing the same program happening again. So we hope those continue to go well. One to note there is on December 5th, the one with Happy Valley, like last year, that's partnered with their tree lighting ceremony. And that was a very successful event last year. So we're in the works with them on coordinating that right now. The next update and change to Operation Santa, that next bullet down there, is the donated foods and toys will all be distributed within the fire district community. but we're partnering with other community groups to make that happen. There are a lot of groups out there within the fire district that are passionate about collecting items and redistributing them. And so this year we're looking to partner with those groups. And so ultimately the fire district will not have the Clackamas Fire Warehouse, but we will be working with other community partners who have already set those up and established plans on how to redistribute into the community. The primary one that we have partnered with is a longstanding partnership, is the Clackamas Service Center. They just recently got a very large warehouse that they plan to use for this exact purpose. Beyond the Clackamas Service Center, though, whether it's through them or separate, we are going to be working with different Elks groups and Lions groups and some of the local high schools who also have programs in place to ensure that, again, we get all these products redistributed into the community within Clackamas Fire. The next main thing there is it's not a bullet. We'll be meeting with the Volunteer Association tomorrow night to present the overview plan of Operation Santa this year and look to, again, have them really partner with this. The success of Operation Santa has a lot to do with them and their involvement on the day in, day out of it. And we continue to look for that, that good relationship and that partnership. So we'll be presenting that to them tomorrow evening. All this information this week will be posted to our website and will also be pushed out kind of in a balanced approach through our social media to make sure the community understands what's going on and how to participate and how to donate. I did mention it earlier, but obviously with 2 years with some slight changes going on because of COVID, and optimistic that next year things will be more back to a normal process. We do plan on starting 2022 planning in the springtime this next year to make sure we are out ahead of it and prepared for anything that we plan to bring forward to the community for that year. That's a rough overview of Operation Santa for this year. I'd happy to answer any questions.
Does anybody have any questions or comments for Chief Whiteley? Yes, Chris.
I am glad to hear that we're going to at least try next year for planning for normal operations. We're at day 493 of the 15-day plan to do whatever the 15-day plan was supposed to do. I'm assuming at some point we'll all notice that there doesn't seem to be a current criteria for ending the mask mandate or anything else, but I'm pretty sure that it has to run out at some point, just because we're about out of Delta, Theta, and other random sorority variants to worry about. So I'm really glad to see that we're going to plan for normal operations next year, because I think the community needs exactly that.
And thank you for, excuse me, Director Haas, for that comment. And that was a lot of why we hope to have the parades back in some form this year. Given the history, the rich history of how we collected donated goods, we were concerned to try to do a variation in such short notice this year. The community would not recognize that we weren't collecting. It would potentially cause a little more conflict and drama than the benefit of it was our concern. So, but I agree with you. We look forward to revisiting this next year.
Thank you, Chris. Anybody else? Okay, hearing none. Our next business item is request the board approval of Mark Whitaker as the budget officer for fiscal 22 to 23, but also at the same time, Chief Brian Stewart wanted to ensure we did not miss approving him for the 21-22. So Chief Stewart, please share your budget officer approval discussion.
Yeah, thank you, Mr. President. So one of the things as we were going through the board packet or agenda for this meeting, I noticed we were approving Mark Whitaker or asking for approval for Mark Whitaker to be appointed as the budget officer for next fiscal year as that budget becomes developed based on anticipated revenues and expenditures. But I asked the question of whether or not we had ever approved him or appointed him as the budget officer for the existing fiscal year. Staff has gone back, I've looked, and we went back into June when Mark Whitaker started with us. And while we adopted the budget for this fiscal year in June, it does not appear that we ever appointed Mark Whitaker as the actual budget officer. And certainly not only is the development of the budget part of the budget officer's responsibilities, the board's required by ORS 294.331 to have a budget officer. And right now, if anyone was to look, our budget officer of record, I would believe would be Christina Day. So by protocol, we want to make sure that we have Mark Whitaker appointed for the current fiscal year 22, as well as appoint him for the fiscal year 23.
So Chief Stewart, can this be one motion or do we need two different motions?
This could be one motion as long as both fiscal years are included.
Okay.
You would
So we are
think
requesting
that
for,
Mark would have remembered such a momentous occasion if he would have been appointed the budget officer this current year. Well, he wouldn't have had to go back to look at all of the notes.
So I'm requesting the board approval of Mark Whitaker as a budget officer for fiscal year 2021-22 and 2022 and 2023.
So moved.
Moved by Jay.
Chris moved.
Chris seconded. Any discussions? And if hearing none, Tracy, please call the roll.
Sure thing. Director Cross,
Yes.
Director Hawes,
Yes.
President Joseph,
Yes.
Director Wall,
Yes.
and Director Searing.
Yes.
Thank you.
Thank you. That was unanimous. The next item is to request the board approval of contract extension with the Public Consulting Group for group emergency medical transport consulting services. CFO Mark Whitaker and Chief Santos. Please take it away.
All right, thank you. Good evening, everyone. So this item is to request a one-year extension of the contract with PCG to prepare our annual cost report that goes to the Oregon Health Authority for GEMT reimbursement. As you probably know better than me, the GEMT is a relatively new program that has provided a valuable supplemental revenue source for the district. PCG has provided this service for the first 3 years of the program for Clackamas Fire District under a contract. And so we're just requesting a one-year extension to allow a fourth year on that contract so that they can utilize their expertise and familiarity with the district to do at least one more, do this last year of the reimbursement request. We anticipate, based on last year's reimbursement revenue, that the additional year of the contract would be between $50,000 and $75,000. It is based on the amount of revenue that we bring in through the cost report. So, and this is budgeted for fiscal year 21-22. So that's it. With that, I would request the board's approval. You're on mute, Thomas.
You're still muted, Thomas.
I lost my connection in between, so I had to juggle back and forth. So thank you for your patience. Does any board members have any questions or comments? Marilyn?
Just a quick comment. I think if you might want to include in the amendment a change to paragraph 5, which still refers to Chief Charlton as the contact for the fire district.
Yeah, thank you.
Thank you. Anybody else? Okay. Do I hear a motion to approve contract extension with Public Consulting Group for the GEMT consulting services?
So moved, Jay.
Jay moved.
Jim seconds.
Jim Siren seconded. Tracy, please call the roll.
Okay, Thomas Joseph,
Yes.
Marilyn Wall,
Yes.
Jim Searing,
Yes.
Chris Hawes,
Yes.
and Jay Cross.
Yes.
Thank you, ladies and gentlemen. The other businesses is there is no action required. Legislative update. Do you see Genova in the audience? Is Tracy, have you seen Genova signed in?
I did not see her signed in. There are a couple people that just have a phone number or their iPhone noted. So if that is lobbyist Genoa, if you could raise your hand and let me know if that's you. Otherwise, I don't see that she's logged in.
We'll give a few seconds for her to, if we don't hear from her. We can also include her later on if she comes on board. If I don't hear, since I don't hear from her, the board committee and liaison reports, Civil Service Commission, Director Syringe.
Thank you. There actually wasn't a Civil Service Commission meeting since the last board meeting. That probably accidentally got put on there. And if there was a meeting, the new liaison, Director Hawes, would be the one giving the report. So I'm assuming there wasn't one unless Chris attended one.
No, actually, Chris, did you attend any?
Yeah,
I
so
don't think so.
believe there's been.
Yeah, Jim, in discussing with the chief, I thought you're right. My memories, if my memory serves me right, you had already reported as a last liaison, and then we passed on to Chris. And since then, the Weatherly who is he, the president?
Yeah, and you know, since we're talking about it, I will have to say,
Please.
Since the last board meeting, not only did the person that the commission appointed as the chief examiner rescind their appointment, in the meantime, the chairman of the Civil Service Commission, Chairman Weatherly, resigned. And I'll have to admit, the last meeting that I observed, I guess in a nice way, I'd call it a disaster. So we have some work to do. I've mentioned to the chief, to gain the trust and credibility of our commission, I think we have some immediate changes that need to be done. And I hope, Director Hawes, as you take over my role as kind of being the observer and the board liaison, I think we've got some work to do in that area. So I just thought I would mention that.
But also, Jim, as much experience you had, Chris would love to have some help from you in getting this right in order.
Yeah, Chris and I actually had a conversation, a week or two ago, a brief conversation about it. So I'd be glad to pass on what I know, and hopefully we can get a handle on our commission. It's an extremely important element of our district and testing at all levels and what we do. So I think we've sort of lost touch of it, and the reason that some of these resignations are happening. And I think it's time to get a hand at make some changes. So I'm looking forward to them.
Thank you, Jim. And thank you, Chris, for your service to that particular area. It may not sound pretty sexy, but I think we have to just get in and get things rolling. So we appreciate your leadership and your action on that.
President,
OB3 is the board informational updates and comments. That actually is for if any of the board members outside of the board, outside of the district activities to report. So today we have Director Cross is going to report on OFDDA conference.
Hey, Chief, I think Chief Stewart was trying to get in there though, too. Brian, did you have something you wanted to say?
Yeah, I had another update on the Civil Service Commission, but I can do that under the Fire Chief's report.
Okay.
Thank you.
So yeah, the OFDDA conference was the week of it was the 4th, 5th, and 6th. of November down in Ashland. The Oregon Fire Chiefs Association had a golf tournament down there the day before the conference too, and I guess they had 80 people show up to the golf tournament. It was very well received. The wind was blowing extremely hard, and I'm sure that a lot of chief officers were chasing the little white balls all over the place because the wind was blowing like 30 miles an hour out there. I was giving some of those guys a little bit of a hard time too about trying to play golf and that kind of wind down there. But the conference went really well. It was a light attendance this year. We're really, I think the OFDDA this is the first major large organization in the state, including everybody, including anybody you can think of, like even the ONA, Oregon Nurses Association, of course, any of the fire department organizations, Oregon Volunteer Firefighters Association, Oregon Fire Chiefs Association, even some of the medical EMS conferences and stuff like that. Nobody's actually had a full-blown conference. I think we're the first ones to actually try that. We did have a little bit of a light turnout. We did it by hybrid. We had 69 attending the conference, 9 by video. We did a hybrid, which seemed to work out real well. We learned a lot from that for next time. The curriculum I thought was very good. I think we did a really good job of having courses that were edifying to the elected officials that came to it and the chief officers that came to it. Had a real good turnout of chief officers also to teach some of the classes and attorneys and stuff. So all in all, I think it was a strong work, a good launch pad for not only OFDDA conference for next year, but I think for other conferences. We did have some growing pains with the hotel, because the hotel was doing their due diligence to try to stay in line with the governor's mandate, and that was a little bit of a struggle for them as well as us, because they're trying to create an environment where people want to come and use their facility as well for future conferences and and there was some interesting dynamics that went along with that, but we were able to work through some of the social distancing and mask requirements and AV challenges and eating food on site and all the rest of the stuff. But kind of typical growing pains that I would think when we're trying to get back into meeting as groups once again, while we're also still trying to follow governor's mandates on that stuff. But so I think there was as much learning on how to do a conference as there was coming out of the classrooms themselves. But overall, it was very successful. The OFDDA, we didn't lose any money. We didn't make much. We made I think we came in about $1,300 into the black, which is not a whole lot, but at least we didn't lose any. And but overall, I think it's a good launch pad for all other people that decide to try to have conferences moving forward. So anyway, other than that, any questions or comments about OFDDA? No. The other thing too, I got to tell you though, for anybody that missed it, our keynote speaker was one of the CIA operatives that responded into the Benghazi terrorist attacks during 9/11/2012. And he was actually the leader of the CIA group, and he also wrote the book 13 Hours and also attended when they did the movie. He was on the set too for helping the actors there, and he did a book signing while we were there. We got a chance he did a keynote speaker, but we also got a chance just to talk to him about his experience, his life experience since 9/11/2012. It was a very neat experience, very neat man. Got a picture with him and got a book signed by him, and so it was. But that was the conference did a great job by having Chris there at the conference as well. So talked a lot about leadership under fire, like he had done when he was in the Rangers. So it was very good. It was a very good conference. It was, for anybody that missed it, they definitely missed a good one. So anyway.
Thank you. Not only your service to the board and the district, but also you are taking this on as your own personal approach and taking the time away from your family. We appreciate your contribution. Well, thank you. In division reports, on behalf of the chief, Brian Stewart.
I'm sorry, it looks like Director Searing might have had his hand raised.
Oh,
I'm
thank
sorry.
you.
Oh, Jim,
Just-
okay.
Just as I had an informational question, I guess. So I thought it was appropriate here. I had a meeting with someone a few weeks ago that told me that the fire district wasn't accredited any longer. And I said, what are you talking about? We just got accredited last year in 2000 and it's good for 5 years. And they said, well, they thought that we weren't accredited any longer. So I said, well, let me find out, because I tell people all the time that we are. So I was just curious, with Doug and Brian on here, are we still accredited?
We are not.
What?
We are not currently accredited. So we did receive and we're accredited. I believe our commission hearing was back in March. And with the first year of invoicing and requirements coming forward in July, and the financial state of the fire district, the fire chief elected to forego paying the annual fees and recommitting to that work on an annual basis. So we are not accredited.
Well,
Jim,
unless
Jim, if you remember, during the Nick's interview, that was one of the things Nick talked about, the value we are spending on the accreditation, and that was a discussion we had. I don't remember the follow-up, but I knew there was a discussion during the interview process.
well, no, yeah, I remember that was that was a question that we talked about with the candidates. But unless I missed something, I don't think I've missed any meetings. It just seems like that's a pretty significant issue, that is something that at least the board would have been asked, hey, if all it was not paying an invoice, but all the work that was put together in 2000 for accreditation is good for 5 years. I mean, the annual compliance is sending a check and doing a updated report. And if that's what we chose not to do, I don't know, I guess I'm just sort of one of those blindsided that all of a sudden we find out we're not accredited when we've been doing it, for 20 years, and then we just choose not to without even any mention or thoughts or input. I don't know. I guess I'm just one person, but it seems like there would have been more discussion about it. So
Brian, do you have anything to respond to that? Maybe we can have further discussion with Nick next month.
Yeah, I'm not sure all of the conversations that Nick or that the fire chief has had with any of the individual board members or the board as a whole. So I think it'd be wise to wait until he's back and able to speak to it directly.
So would you put that on next month's agenda to have this information discussion item about accreditation, address Jim's concern?
Yes, we'll add it to the agenda.
Thank you.
yeah,
Thank you, Jim.
Hey, Thomas,
Yes, sir.
question. I mean, I don't mind talking about it at the board meeting. It's probably appropriate, but do you think that's the executive committee? Maybe you and Marilyn talk to Nick about that on a executive committee thing and maybe bring something back to? Would that be
But I
appropriate?
think the board should be made aware and why and how it was done.
Okay, I'm with you.
Okay, Jim, that satisfied your question?
yeah. Oh, yeah.
Okay, great.
Yeah.
Thank you. Marilyn, do you have any questions about that?
No, I'm just, I concur with Director Searing. I'm actually surprised to hear that happened, because he did mention that, but he said after discussion with the board is what Nick said in his interview, so.
Okay. Chris, do you have any comments? No? Good. Great. Thank you so much. Appreciate you bringing that up, Jim. Again, that's one of the reasons I brought up this purpose, vision, and mission discussion, because it was sent to us, like Jay said, it was sent to the board in September, but all of us, in our busy life, did not study detail enough and didn't discuss about it at the board meeting. So I think that's important. When we think about it, we need to bring that up to the board, to the board meeting, and not only for our information, but also the community need to know. That is part of our transparency. Our community need to know if something like that happens. So and it will only clear our name. That is not going to create any name calling, or we are not looking for any scapegoat or anything like that. So just to clarify our position, why we did that, how we did that. I remember the discussion Nick had about that, but I can't recall all the details. So with that, we will, Chief Stewart.
Yes, thank you, Mr. President. So this evening, I'll keep my portion fairly short. Certainly included in your board packet was the new report for staff and the fire chief. The fire chief's highlighted a number of items across the district, and we included a couple of photos of some key pieces, including a public educator, Tammy Owen, back in the classrooms doing hands-only CPR. A little different this year because they don't get to take the mannequins home and teach others, but at least we're back out teaching kids in schools how to do that. And then below that, you can see the new SJX low water boat that we received from the state just a couple of weeks ago. On the backside, there's some other information, including our current staffing levels. So when you look at the overtime trends, you look at what staff is doing or what the fire district is doing, you have an idea of if we're appropriately staffed or if we're understaffed according to our budget. For example, this month, our fiscal year budget for people on apparatus responding is 227 FTEs, but we currently have 220. So we're down a total of 7 response positions. Risk reduction, we're right where we were allocated, and then staff, we're down a couple of positions. The suppression and support volunteers don't have any allocated number or expected number. It ebbs and flows, and Chief Dieters has done a terrific job of keeping those as high as we can. But we do try to make sure that we have folks in the academy every fall. So you can see that currently with suppression, we have 51 suppression volunteers on the line, as well as 15 in the academy. And then support volunteers, we have 28 support volunteers, and then 3 are in the current academy. You can also see on there the number of volunteers or their activities, the number of drills. Community involvement. This was a glitch in the template that we were using. There were no community outreach events that the volunteers were involved in, but the template just didn't go to 0. So we've got that fixed for next month. And then to the right, you see the duty shifts, and on the far right-hand side, just to be clear, so the rehab operates out of Station 21. And so some of our support volunteers spend the night there. They were there 15 of those 31 nights. But we also have support volunteers who respond from home to get the rehab. And so there were another 14 nights out of that month that we had support volunteers. And then for the data, in terms of calls, we've kind of reduced this down to some key pieces and looking at trends, just like the finance piece over the last 3 years about where EMS calls, fire, good intent, false calls have been. So you can see what our trends are over time. And then mutual aid has been a piece where it's come and gone, and people have asked questions about what are we giving and receiving. And so rather than giving, I believe it was 4 different graphs looking at different things, which were just a snapshot in time. Again, we look to provide a 3-year kind of trend of incident response. And what you see is anything above the line, above that 0, are the net of what we've given away, of what we've provided more than we've received. And then going below the line is what you see as we've received more than we've given. Lastly, you see the average company time. And on there, you see what the average time between response and preparation for response, which would include activities such as physical conditioning, apparatus and equipment inspections, training, whether it's manipulative or psychomotor. And so that for across the organization for all the response companies was just over 100 hours. And so each of those companies on average was about 14% of the time committed. That's the fire chief's report. I'm happy to answer any questions on that. And then I'd like to just touch on a couple other things.
Any board of directors have any questions or comments to Chief Stewart?
Actually, yeah, Brian, I just wanted to say I actually like this. It's really simplifies a lot of stuff. Moving forward, I'm sure there's going to be some more information that as we vet this out a little bit, these changes. But overall, I like the direction of where we're going of kind of simplifying the information, but it is very, to me anyway, it's very understandable. And I appreciate that effort that that you guys put into this this page, honestly. But thank you.
I applaud as well all the effort you're putting into modify and making it simplified version. Brian, I have a question for you. Public educators returning to the elementary and middle school for hands-on CPO. CPO. Now, are we able to go into all the schools, or are we? Can you give me a little bit of information about it?
I'm going to ask Chief Whiteley to touch on that because that's his program area.
Okay.
Yeah, absolutely. Thank you for the question, Director Joseph. Generally speaking, yes, the school districts have protocols in place regarding guests and what the guests can and can't do in there. That is school district specific. So, for example, the picture you saw there, that was North Clackamas Schools, and they do allow people in to do that type of work. Now, there's a little bit of gray area, as sometimes that is the principal may not see their intent being met based on a school setup or something. So it wouldn't be a blanket response, but generally speaking, we're finding we're able, with restrictions in place, as you saw there, mask, spacing, we are able to kind of start re-engaging on the community outreach. It's a lot of work for our staff, though, and quite exhausting to be audible teaching all day that way, but they're working really hard to get back in there.
But I think doing things like that also bring a little bit of normalcy to the children in the classrooms, you know, instead of being bogged down and being masked and everything else, you know, they are all going through the trauma. But I think anything like this we are able to do, help them to bring a little bit normalcy to their life.
Absolutely.
Thank you.
And then
anybody else? Brian, you wanted something else?
Yeah, I'll just touch on civil service briefly. So the Civil Service Commission did hold a special meeting on November 10th. So after the regular meeting in October, I believe it was on the 12th or the 13th, we did have the chair, Will Weatherly. He resigned, as well as the newly appointed chief examiner resigned the following day of the meeting. And so we wanted to get the civil service back together and do a couple of things. One, appoint a temporary chief examiner, because if we don't have one, we're going to find out that's the time that we need one. So we wanted to just get ahead of Murphy's Law. And then secondly, also to make sure that that commission had a chair. So we met on the 10th. Jeff Davis, I believe, brought forward Commissioner Dilley as a nominee for the chair. He was unanimously supported. So your chair is Jim Dilley of that commission. And then secondly, we also had a commissioner vacancy with Will Weatherly stepping down. So we're looking at doing that recruitment with the anticipation of bringing candidates forward to this board in January. So it's a little bit of a lag time, but of course it's the holidays, which is always hard. But we also wanted to make sure that the candidates had the opportunity, whether or not they chose to take it, but the opportunity to attend a Civil Service Commission meeting. And so they would have that opportunity at the regular meeting in January, which could then lead into interviews with this board. Lastly, with the chief examiner position, we requested that the commission approve a temporary appointment. So Division Chief Yerke is the temporary chief examiner for a period of up to 6 months. And we spoke with them about the potential for a rule change, which we'll discuss in January, in terms of allowing individuals outside of our borders to apply for that position. This last recruitment, we looked and we had 2 applicants, one who was an employee with us, non-civil service, but an employee with us, and then the other individual who was appointed and subsequently resigned. So those are kind of the updates, and I'm happy to answer any questions.
Well, I know Jay has a question or comment, but I want to make sure now that we have Chris Haas is in the liaison for that, please make sure to keep him in the loop. Jay. Jay, did you have a question? Yeah.
Oh, no, I'm good. Thank you.
Oh, okay, great. Thank you. Thank you, Chief Stewart.
Chris,
Our next update. Yes, Chris.
Yeah, I'm sorry. If I got a notice, I'll have to go back and check, but I don't recall seeing a notice that there was a meeting November 10th. So I'll go make sure that it showed up, or if I missed it. But yeah, I would say just from a little bit I've heard, we have some work to do there. I don't like hearing members resigning and big changes and things going on like that. And when Jim says he can best describe that last meeting as a disaster, I think we better do some digging and find out where the root cause is.
I think it will be helpful for people like Jim and Chris, and who have some kind of background on that, help Nick and Brian on this, making that function properly. So that should be.
Yes. Thank you for the comments, and I apologize if we overlooked getting an invite to you, Director Haas. We'll make sure that's corrected moving forward.
Okay, here, anybody else? Okay, now we'll move to Health and Safety. Chief Heather Goodrich.
Good evening, directors. So Health and Safety has been busy. Specifically, Corinne, Ellen, and Alicia have gotten everybody through from the line for our pre-physicals in the past 2 months. They've worked extremely hard and they are dedicated, and I'm just really proud of that team. We worked so hard because Ellen Schachtel, our newest medical assistant, she was off at the end of October and has had a baby girl whose name is Marin. So we welcome Marin to the Clackamas Fire family. Ellen will be off for the next 2 months. So we tried to get everything rushed through so that way there wasn't too much work on the rest of staff. The other highlight that I have for this month is we brought OSHA in last month for a consultation. So when you bring OSHA in, they go through the different programs that you ask them to go through and give feedback. So it's a great way to establish a relationship. We have one now, so we don't have to just go to consultation. We can just call our rep and ask questions, give concerns, things like that. So a few of the highlights from that was they looked at a lot of our safety policies, and we are really good about writing policies for operations, but we seem to forget our administrative staff, fleet, facilities, logistics. So we will be looking at all of our safety policies and making sure that they're representative of the entire organization. They also looked at our fleet building, fleet facilities, logistics. We had never brought OSHA in since that building was built. And so they went around and did an inspection of that building. So we have a few things to work on there, and Bill Bischoff will be taking care of that, but very few. Overall, it went really well. A couple other things that we need to work on is we do not have a specific vendor or contractor safety guide. So when we bring in vendors or contractors, they know our safety rules here. They may have their own rules, but when they're in our house, they need to be following our rules. So we'll be working on that. And then the big one is we didn't have a PPE hazard assessment. You have to have that for every job task. We have it for some of our tasks, but that will be something that wellness and specifically our athletic trainer will be going out and doing job hazard analysis for all of our job descriptions. And we will add the PPE hazard analysis with that as well. So that's probably not very exciting for your world. This is a new world for me, and it went really well. We're going to bring them out in 6 months to look at what we fixed, and then we'll bring them out every year to look at a couple different programs just so that we make sure that we're doing the right thing. So I'd be happy to answer any questions.
Any directors have questions or comments? Anytime, Heather, when we can do proactively reaching out with the agencies, regulating agencies, I give my kudos to you, and as a business owner, that's what I wanted to do. That my kudos to you and our district for reaching out and having the courage to be inspected and checked by somebody. So making sure we are safe. Thank you.
Thank you.
Chief Stewart, do you have anything more to add as a strategic and business services?
No, thank you. Doug Whiteley has a piece under community
Yes,
services.
that's coming next. Yeah, Doug.
Yeah, perfect. Thanks, everybody, for the opportunity to chat with you again. Just give a little update on community services. Chief Stewart did reference that October was Fire Prevention Month, and you got to see public educator Tammy Owen spotlight doing hands-only CPR. If you get a chance, if you haven't looked further on in the board pack at the social media comments, you'll see a Facebook post from North Clackamas Schools. Not only pointing out Tammy's great work, but also Deputy Fire Marshal Carrie Shanklin as well. They both taught at several schools teaching fire safety, general all-around safety, and also hands-only CPR. They're really excited to get back to the schools. They've had to get really creative over the last year or so, and with the opportunity to get back in, they're doing their best to reintegrate with these groups and get the safety message out there. So I'm proud of them for all that work that they've done. Over the last month, they've also been able to focus on several virtual open houses. Given COVID, it didn't feel appropriate to open up the fire station to the community. Again, that's something we hope to revisit next year. And then also they really worked hard to feed out a lot of safety messages to the school through the school's messaging platform. With only 2 of them, it's almost impossible to get face-to-face with all the schools. So they also take a conceded effort to make sure they get a message out, generally speaking, to all the families and the school districts to share. The other pieces with with community services has been a lot of work with OpSanta lately and continuing to try to make that a successful program, I believe now in its 47th year. I have to answer any questions you guys have for me.
Anyone has any questions or comments? Thank you, Doug. Did I hear something? No. Okay. Thank you, Doug. Chief CFO Whitaker, please update us our financial update.
Okay, thanks. Good evening again. Yeah, just a few quick updates. One is just to keep the board aware of our tax anticipation notes. So we were able to get through the first tax disbursement of November without having to borrow from the tax anticipation notes. So at the end of October, we had about $250,000 left in our LGIP account, which is really low. But the following Friday, we got the first disbursement of property tax revenues from the county for November. They are doing deposits every Friday, and that put about a little over 2 million more into the LGIP account. So we were able to meet payroll for November, and so we won't be incurring any interest charges or having to borrow from the TANs. But it was a relief to have that there as a backstop when we saw that bank account get that low. So appreciate everybody's support on that. Other update is the external auditor is doing their review this week. So the year-end and auditing process for last fiscal year is ongoing this week. And then lastly, I'll just reference that the financial report for the district general fund through the end of October was included in your packet. Similar to previous months, most things are on track. I think there is the one that isn't probably is some extra spending on overtime above where we would expect to be this time of year. And so that's something we're gonna keep a close eye on and see if there are any adjustments that need to be made. And now that I am the official budget officer for 21-22, we can come back and do a supplemental if we need to. So happy to take any questions, but that's all the updates I have for tonight.
Any directors have any questions? Mark, my question is that what is that loan that we, like a credit line we took, what is it called?
Tax anticipation notes.
Yes, we only pay a one-time fee for that, right?
So the only fee that we'll pay, since we didn't actually borrow, is for basically our lawyers and the bank's lawyers for drawing up the loan documents.
No other fees.
Right. And then if we had borrowed, we would also have an interest fee, but we won't have to pay that.
Okay, great. Thank you. Anybody else? Okay. Thank you, Mark. Division Chief George Santos and Dan Mulek. Report on emergency services, please.
Yeah, good evening, everyone. I will make mine quick and get out of the way for Chief Mulek. Dr. Sani presented a lot of high-level stuff that's taking place in the county and in our organization. And outside of that, and that's certainly consuming us, but outside of that and what's in the board report, I have nothing profound to share. So I'm happy to discuss anything you'd like at this point, or I'll turn it over to Chief Mulek.
Thanks, Chief Santos. I think next month I'll bring in a guest speaker to cover all my talking points too. So well played. No, it was great to have Dr. Sani on there. I just want to give kind of a quick rundown of a little bit of changing in operation. We have a new training chief, Kyle Olson, who is a shift battalion chief on B shift in the North Battalion. He is our new training chief, and Chief Ken is going to remain on the line on A shift in the North Battalion. And so we're going to have Chief Olson and I are working side by side to work on some alignment with operations and training right now. I've established 2 focuses for our training division moving forward for the next year. One of them is a very familiar topic in the fire service, and that's communication. We have a lot of we have a lot of struggles with and challenges ahead with some technology pieces, with changing with CCOM and how our radios operate going to a digital system come December. We have just a couple. We have some things we can run through training to improve our communication on the fire grounds. That's one of the biggest ones. And then the second goal is incident command system training for our officers. And so that's kind of our focus in the training division, our focus in operations, in addition to the kind of hitting points from the after action from the September wildfires last year. We're really putting a focus on the being able to fulfill the need for like an escalating incident or a prolonged incident with staffing reserve apparatus with the equipment required to respond. And that's with MDCs, which are our computers that are based out of the cab, to having radios, to having basic equipment on some of our reserve apparatus. So that's kind of the focus moving forward with the operations division. And just to summarize, there is a note in the board packet about a fire that occurred. I believe it was October 11th, 1:30 in the morning in Oregon City. Our crews responded to a passerby called in a fire that was it was a smaller home in Oregon City, less than 1,000 square feet, that the initial incident commander said was a defensive fire, meaning that there was so much fire involvement that we weren't going to safely be able to put a crew interior. We knocked the majority of the fire down. We put crews inside to search, located a victim. We put crews on the roof to ventilate, and we had that victim removed within 12 minutes of being dispatched. So that is 1:30 in the morning, waking up and going to a fire with tired, sleepy eyes. And it just is a statement of the progressiveness and the training in our organization. I'm super proud when you hear a timestamp like that. It's incredible. Unfortunately, there was a fatality on that fire, but we gave them every opportunity we could for survival. So we did 30 minutes of CPR and working the patient before calling it. So great things by our crews, very responsive. And that kind of summarizes the operations side of it. If you have any questions, I'd love to answer them for you. Jay, go ahead.
Yeah, Chief, I also understand we got the new boat, and then just a couple of days after the boat, we rescued somebody with it too, right? Isn't there something along those lines?
You know how this works, right? The boat, they sold us on the light package on how this was going to be the greatest thing on the water and low water at nighttime. And what do? The first call is a technical rescue on the riverbank in the middle of the night. So that's exactly what happened. That is exactly what happened. We're actually still working on getting a couple things installed on that boat, but they had it in service and had done some training on it, and the crews were turnkey on it. So
that was actually the first part of November, wasn't it? So we'll hear it in next month's report or something.
Right. Okay. It was, yeah. Okay. Yeah, isn't that funny how that stuff works out, though?
Very good.
Thank you, Dan. Anybody else? Questions, comments? Okay. Since there is none, 11:59, Secretary Nate Horn, are you here to give an update? Oh, here is Nate. Hi, Nate.
Hello, Mr. President. How are you?
Good, good.
Good.
Emphasize on the
board.
president.
Of course. Good evening. And I have a list of items, but I want to echo Dan's comments about the fire in Oregon City. I was on that fire, and I talked to the individuals who pulled the patient out of the home, and just hearing their story. You know, it was Mark Gaiman and Joe Kasemba who performed the search. They went into the home through a side door, found a space that was they were able to enter, and found the individual in the bathroom. We don't know much about that story, but just their efforts to find that tenable space and perform that rescue. I remember Mark Gaiman, I asked him how that went down. He said, yeah, we found him. We started talking about how we were going to get him out. And before he knew it, Joe Kasemba had already brought the guy out to the front yard. He just grabbed him and went. So appreciate Dan Mulick bringing that forward, because it wasn't on my list of items, but just being there and watching the crews do CPR in the front yard and just rotate through doing CPR, because that patient was worked up for at least 45 minutes. So kudos to Gaiman and Kasemba for making that move, and that speaks to our training level. And it's good to hear those priorities that Dan brought forward. Anyhow, I'll get to the rest of my list here, and I appreciate you guys having us on tonight. Wanted to speak to our member that was hospitalized for sepsis last month. He is back at home, and good to know he's got approval by his physician to start working out again. So he's pretty excited about that. I saw on social media the other day, he posted that he was on a treadmill for the first time in months. So he's pretty excited to start working out again. Local 1159, as you know, has a flower fund. All of our members pay into it, and it's a pretty cool deal. We call it the flower fund, but it's really a benevolent fund. We support members through hard times, good times. We supported a member who couldn't drive for a while due to a tumor that he had in his head, and we provided taxi service, you know, $500-600 a month for him to go back and forth to his doctor appointments. So it's a really cool benefit that our members have with the flower fund. This month we were able to provide flowers to 3 of the office staff, actually, Jess Ode, Rachel Trotman, and then Ellen over in Wellness. We got flowers after them, so congrats to all of them. And then congrats to Steve McAdoo as well. He had a granddaughter this week or last week, so we got some flowers over to them as well. And then as some of you may have heard, there was an OCPD officer whose 16-year-old son had to go up to Seattle for a heart condition and may need a heart transplant. So we donated some funds to that GoFundMe account, and we're watching that closely. As you know, we're pretty politically active and like to keep our ear close to what's going on. But we spoke to 2 county commissioners last week, and also a commissioner candidate for May. And then those endorsements will come out next week from the local. Shop steward JT Anishirani from Lake Oswego. Him and I sat in a town hall with Senator Wagner and Senator Lieber this last week. The topic was behavioral health. And they really wanted to get a first responder perspective on behavioral health. And from the call coming in to getting on the apparatus, the notes that we get, and then how we react when we get to those scenes. And JT was able to provide some personal and professional experience with behavioral health and some of the things they've done at Lake Oswego. And we expect some legislation to probably come out of that, either in the short session in 22 or in 23. So we're going to keep that conversation up with those senators. And then finally, I wanted to speak on the Apprentice Program. I'm working with at the state level as the administrator of the program, and it's getting off the ground. It's slow right now just because it's a new program, but I think it has potential to be a really long-term program to provide staffing, not just to the 3 agencies involved, which is Jackson County, Eugene Springfield, and Clackamas Fire, but potentially long-term funding if the first couple of years go well. We look for some of our legislators to support that. Val Hoyle is a big supporter of the fire service. She comes from 3 generations of firefighters. Her son's actually in the paramedic program right now. So she's a huge supporter of the fire service. And the whole goal is to get more firefighters, professional firefighters out there. You know, the Wineland Fires of 2020 was a big instigator of the program, and something Carl Kinnick has worked on for 10, 15 years, if not his whole career. So that's exciting. I have a meeting tomorrow with Bowley again to define some things we need for the training piece. But Josh Gerke is our admin representative, and President Mark Corliss is our labor representative on that Bowley committee. So some exciting stuff going on there. And then we'll update as that stuff moves forward. So unless you have any other questions, that's all I got for tonight.
Thank you, Nate. Does anyone have any questions or comments? Well, you know, we are making good progress in a relationship building with Local 1159. So you are able to update and bring the board appraise of what's going on. So we appreciate that, and thank you.
Thank you.
Assistant Chief Steve Dieters, will you update on the volunteer service?
Absolutely. Thank you, Mr. President, members of the board. Chief Stewart covered a lot of the shift and stuff. I would just like to touch on a couple of things. First off, I wanted to say I've been out of training for a couple of weeks now. And when I left there, Kelly Franzen and Radonna Demeter and Justin Lynn were given sort of some of Peggy's tasks since you know, retirement was at the first of the month. So I just wanted to say thank you to those people that have taken on some of those responsibilities. And Justin Lynn has really done a great job in the interim in an absence of a coordinator. So he's really taken on a little bit more work, and he's doing fantastic, and all of them are doing really great at it. And so some of the drills that they put on were winter operations, water supply, ladders and bailout, and then some house fire evolutions. And then the EMS training was estimating blood loss. And that's all I really have to add to what Chief Stewart already added to. And I'm happy to answer any questions before I turn it over to President Hamley.
Thank you, Steve. Anyone has any questions or comments? Okay, President Hamley.
Thank you, Mr. President, members of the board. Last month was our big quarterly meeting. So we hosted a meeting at the training center with about 20 of the volunteers that showed up. We had Chief Dieters there, Chief Brown, and Director Searing as well to give us district updates. Not a whole lot this past month, as they said, zero public engagement. So pretty quiet on our front. Tomorrow we're hosting a Zoom meeting with all of the association, a mandatory meeting to get information on Ops Santa. I've had a lot of people reach out to me. It sounds like we're pretty fired up and ready to go for another successful year. That's all I've got for you today.
Great, thank you. Thank you, President Hamlin. Correspondence and informational items. Does any board members have any update or comments about those two agenda areas? Hearing none, our next board of directors meeting will be on Monday, December 20th, 5 p.m. by remote video conferencing. And it's 6:39 p.m. The regular board of directors meeting is now adjourned.
Good night, everyone.
Thank you, everyone, and good night.
Goodbye.
Good night.